Hello everybody, my name is Dr. Fabian Schick. I'm one of the founders of BioHealth Munich and SDS Ambassador Europe, and unfortunately I cannot be at the JCCI this year due to family reason. We're expecting a baby, and I think you will all understand that I cannot be here in person, but of course I will hold my lecture this year in a digital way, and it's always a great pleasure to be with you here. Just for the little history, I am organizing the failure hours with SDS with Ayla Tabit for more than 2 years, and this is why my lecture is called From Setback to Breakthrough, the path to perfection in metal-free implantology. So I want to show you techniques and strategies how to prevent failures and how to solve failures if they are there. And let's jump right into that because I have 20 minutes. So in the normal failure hours we have like 10 to 15 tips, but in this lecture I just picked 2, one depending the bone and one depending the soft tissue, because I saw a lot of things in these 2 years in these webinars, and this is what I can just tell you is the most important thing for the bone and for the soft tissue. So let's get into that, and we will of course talk about ceramic implants. This is why you all are here. This is what we all love. This is what brings us together, and it's always a good feeling when I see a ceramic implant going into a vital and bleeding bone. And after like 6 years working with ceramic implants, it's a steady good feeling to work like this. And let's talk about ceramic implants and reasons for their failures. You see that with the bone here in this picture, something is wrong. You see the bone quality is not so good as you might expect from a healthy bone, and maybe our ceramic implant has a problem here to osseointegrate and to heal in. We will always talk about strategies how to avoid them. You see, this is a machine called Cavital. This is an ultrasound, and we can get an idea of bone quality before we perform the surgery. So, and what it's all about, of course, we want a better implant and overall health, and this is our vision, what we all follow. Just for my person, my name is Dr. Fabian Schick. I'm specialist for biological dentistry and ceramic implants. And in the middle, you see Dr. Johann Lechner. We all work together at BioHealth Munich. On the right-hand side, you see Dr. Florian Notter. And because we do a lot of research in the issue of cavitations, FDOJ, RANTIS, CCL5. We are the Munich research team, and I think I will show you a little bit more in the next slides. So I talked about bone quality, and in this study, this year was published from the group surrounding Ganati, Sharam, and he just showed that there is differences in bone qualities, especially after extracting the tooth. With his beautiful 3D visualization tool, he showed us that wounds not always heal perfectly, but for a ceramic implant, we need perfectly healed bone because we want a good primer stability and a good osseointegration. Okay, and when we expect bone that has a lower quality, it's always better to clean this first out before we place the ceramic implant. We also showed with the next study, which was also published this year, this is Sharam Ganadi and us, like Dr. Johann Lechner and me and Dr. Dole, and we also showed differences in gene expression and in histologies to make sure that everybody understands that we have different bone qualities, and maybe this is also a big issue for our osseointegration of our loved ceramic implants. So it's not just to get the screw into a table, it's just to get the screw in a healthy bone, in a vital bone, and to get good osseointegration there. So what does this Cavitao show us? So it shows us high density with healthy bone structure, and it shows us low density with possibly osteolytic bone, and in this osteolytic bone areas we have a increased levels of RAN-TCCL5. And of course, this might be a problem for our osseointegration. And when we know before that we have these areas, it's always better to plan the surgery. You know, if you know that surrounding a dead tooth, for example, you have a big osteolytic area, you cannot just extract the tooth and place an implant. You have to first clean all the bone out, that you have a healthy bone structure that bleeds in a fresh way. And this is where you get your regeneration and your osseointegration. And this is for me one of the best strategies to prevent a failure. So where do we find these areas of osteolytic bone? It's actually always the same. Everywhere where we find immunological stress, we will also find these osteolytic areas. So I talked about the extraction wounds, which Sharam Ganati showed us with this 3D visualization tool, and we show this with the Cavitao also. But we also find these areas surrounding dead teeth that are infected, and also surrounding the titanium implants. This is really important for us to know, because when we extract a titanium implant and just place the ceramic implant, it might not solve all our problems. And of course, I talked about overall health too. We want to improve the overall health from the patient, and this is why we have to take care about these issues. And when you see this, this is a normal surgery for us. So the implant does not go always where the root was. It goes where the perfect prosthetic position is and where the healthy bone structures, because we want to create a good regeneration there. And this is why we first remove all the silent inflamed bone, all the osteolytic bone, and then get the good primer stability in the healthy and vital bone to get the best possible regeneration there. And what is the top 3 findings of the bone issue? It seems that the cavitation problem is more common than we think, that cavitations are may be caused by incomplete healing, and immunologically compromised bone structures can be a significant risk for our successful osseointegration, and sufficient biologically active and vital bone is really essential to ensure primer stability and to promote effective bone regeneration. So this is my bone part. Now we go on with the soft tissue. And for the long-term stability, for the sustainability of your implants, it's always really important to get a keratinized soft tissue surrounding your ceramic implant. So we all know that ceramic implants love soft tissue, and we can create a good connection and a good sealing that protects our bone underneath. So what we want to see here is that we have I call this immunological firewall, because it protects our bone from all the bacteria that might be in your mouth. If you have a stable connection there, the bacteria can have no chance to go down and cause an infection or peri-implantitis. And this is why you have to always take care about the keratinized tissue. I will show you in the next video a little comparison in between titanium and ceramic implants. So I go there with the air, and I want you just to make sure to see what happens to the soft tissue on the titanium and on the ceramic implant. So I just start the video, and you see that the tissue on the titanium, it flaps a little bit away, and the immunological door goes open. And on the ceramic implants we have a really good sealing that protects our bone underneath. And this is of course a big advantage over the titanium implants. It's also of course better for the aesthetics and so on, but we want to protect the inner of our body, and this is also where you have your tissue on the tooth. It's also a problem when you have periodontitis, of course. This is also an issue where the immunological door is open, but it's also an issue with the implants, and we of course have an advantage here because of the differential sealing patterns of ceramic to soft tissue and titanium to the soft tissue. So let's go on. What do we see in this little case? So I talked about titanium and I talked about ceramic implants. In this case, you see that we have a lack of keratinized tissue in the upper left, and I show you where we can have strategies to get to the point that we go on a sustainable situation on the lower right. So we extracted this implant and replaced it by a ceramic implant, so we have a better material for the soft tissue, of course. But this is not enough, because you see in the lower left that there is no keratinization, although we have a ceramic implant. So what we did is the free gingival graft, and this is a perfect technique and a really important technique to get sustainable success for your ceramic implants. So, and this is my biggest tip and my biggest strategy for the soft tissue, that you always take care about creating a protecting keratinized tissue surround the ceramic implants. And of course, when you have done this, you get a beautiful aesthetic, of course, on top, and you see how much height I gained only through this technique. And on top, it is more aesthetic, and it's more it's a better hygiene for the patient, and this on top makes the sustainability for this case. So I just want to show you one more case, and it's a case where we in our clinic had a big failure, and I just want to show you how we got this solved again, although it was a really tough failure. So I want to just explain you what happened. So this patient came and she got 4 implants in the front. Of course, there's other things to do, and so, but we will just focus on the upper front. So these 4 implants were placed and everything was fine. So we had a good osseointegration phase, and this is what we had for the outcome. So looks quite good, the tissues looks good, and yeah, the implants are well placed, they are long enough, and yeah, we just did the prosthetics here. And after 3 months she came back and told us when she puts pressure on one implant, there sometimes comes a little bit of yellowish pus out, and we just cleaned it out, of course, and tried everything to rescue it. But in the end, and you will see the bone defect here, in the end we had to extract this implant. And yeah, what we got there, you can maybe imagine, is not a really good aesthetic then. So you remember the picture from before, and now I will show you the picture what we got after the healing of the extraction of this implant. So, and of course, the patient was not satisfied with this situation, because it's a high gummy smile, and of course, in these cases, it's always these cases where something goes wrong. And yeah, I just want to show you a strategy how we solve this. So, of course, this is a big failure and a big aesthetic thing here in the front, and this is when it goes over soft tissue, this is the point where I have to call my good friend Ilian Dage from the Netherlands, and yeah, we discuss always the cases, how can we solve them, and how can we fix soft tissue, and yeah, it's quite fun to discuss that with you, Ilian. Shout out for you. So what I got back from him is this. This is the incision line for my first stage surgery. Of course, I wanted to get the soft tissue down, and I had to thicken it again. So the thing was to get a connective tissue graft from the palatum to thicken it again in the first stage. So I did it with the incision, what I showed you before. This is the connective tissue graft, what is de-epithelialized out of the mouth, and yeah, we just got it in position through this incision. We sutured it again, we closed it, and this is what we got. So you can just compare the first picture to the second picture, and you might see a difference. So maybe there's a little papilla growing, but as you can expect, with this situation, the patient was not satisfied too, because these are 4 implants. These were 4 implants, now this is 3. And yeah, she told me on the right-hand side, it's perfectly aesthetic. And on the left-hand side, I see a little white thing there. And she didn't like that because of the high gummy smile. And of course, I needed to call my good friend Ilian Dagel from the Netherlands again. And what I got back is this one. So you see, it gets a little bit more complicated. We now use the tunneling technique with a coronally advanced flap combined, and of course did another connective tissue graft there. Just to explain what happened, you see the first picture is what we got in the really beginning. The second picture is after the first stage surgery. The third picture is the connective tissue graft, what I got from the palatum. And yeah, this is extraorally de-epithelialized. And yeah, this is my tunnel where we just lift the tissue without putting too much tension on it. Now you see on the fourth picture where the connective tissue graft is in position. And you need, of course, volume. You lost a lot of volume, you need volume. So you cannot put a little connective tissue graft there. You need a big one, okay? And yeah, this is what we closed the wound. And after a few days, it looked like this. After 2 weeks, it looked like this. After 3 weeks, it got better. After 4 weeks, it looked like this. Hey, and we have the same height as on the other side. Of course, we cannot place an implant there anymore because there is no bone anymore. And we, of course, during the extraction, try to build as much volume up as we can, but it was just not possible. But when we can solve these failures also in a soft tissue way, this is also a good strategy you might think about when you have cases like this. And yeah, I just show you, this is the temporary, and she will get like a Maryland bridge. But when you see on the left picture how much volume we gained and where the papilla is on the right-hand picture. So yeah, this is just a failure. Of course, it's maybe not absolutely perfectly solved, but it's a good technique to get these issues solved. And this is an extreme case, of course. And yeah, I just wanted to show you where is the limits. Maybe a little bit more soft tissue recession will not be possible with that technique. But in this case, we satisfied the patient. And yeah, this is how we got from the first picture to the last 2 pictures. And I like this case really much because I think it's really impressive what we can solve with a good soft tissue surgery technique. And this is what I want just to give you for the last strategy, what is really important that you can do with your hands, with the own body material. And yeah, this is a beautiful thing. And yeah, what is our vision? We want, of course, to bring our patients back into regulation and homeostasis. For what? For supporting patients' oral and overall health for a better quality of life. And yeah, this is where I say thank you. This is our new clinic. You can just scan the QR code if you want to see what we do there in Munich. We opened the clinic like 5 months ago. So yeah, it's quite exciting, and I hope you will enjoy our website if you read that. And I hope you will enjoy the JCCI. It's always a great community there, and I love to be there next year. So Bye from Munich and have a great JCCI 2025. Bye.